guys, Dr. Christy Ennis. I absolutely love helping people to move better and get stronger, and of course safely, which is where these 5 exercises come into play. This is kind of the second edition, so make sure you check out the previous video to get the complete list, and then let's get started. Our first exercise, and you can do this on the mat or on the bed, is the side lying leg raise. So to do this one correctly, you want to make sure that you're rolled all the way on that hip, and you can put some extra padding on there if you need it, and I know I certainly do sometimes. And then you want to look down at your legs. So you should see your pretty toes and some of your feet, but not much of your leg. If you do, it means you're too far forward. From here, you can either keep this bottom leg bent, or you can bend it if it's more comfortable for you. You're going to turn your foot down, and then you're lifting here. So you're coming straight up and down. You're lifting just to about parallel, right? You don't need to lift super duper high. And you're doing it until you feel a little bit of fatigue. So that depends on the number of reps, right? Or that makes the difference for the number of repetitions. And now, here's where people go wrong with this one. The first thing that people do most incorrectly is actually the setup position itself. So typically what I see is that people have their legs way too far forward. And when you do that, you actually start to use the hip flexors more than you do those side butt muscles. So the second thing I typically see go wrong is people either rolling way too far forward on their hip or way too far backwards. And again, you won't use the correct muscles to do that. Number 3 is when people lift their leg, they scoot it forward a little bit. And what happens there is that you tend to use the hip flexors more so than those side butt muscles, which is what, again, we are really trying to focus on here. Next one is a straight leg raise, which works the quads and the hip flexors. So to start with this one, you will straighten the leg that you're working out. You're going to try to make sure that you keep a happy neutral spine here. Squeeze the quads so you're straightening out that knee, and then you're lifting that leg up without changing the position in your spine, without letting this leg go. And to get a little bit of the inner and outer portion, you can turn that foot out, and then you can also do the same thing and turn that foot in. And now here is where I see people go wrong. The first thing that I see most often is that people either don't contract their quad muscles first, or as they're lifting their leg, they kind of let that contraction go so that knee is bending a little bit. And then what that means is that actually just puts a little bit more stress through the knee, and it's not activating the muscles nearly as well. The second thing that I see people do is arch their spine as they're either lifting that leg or lowering that leg. So again, putting more stress on the back and not really focusing on the muscles that we want to focus on. And then the last thing that I tend to see is that people lift that leg way too high. And again, now we're kind of negating what we're trying to do there. Number 3, if we're using, normal English here, is the reverse crunch, which actually helps to activate all of the abs, but with more emphasis on those lower abs. So to do this one, legs go straight up to the ceiling. And from here, you can press down your hands a little bit, but those feet are going straight up to the ceiling, straight up to heaven, however you want to word it. And it's just that little lift, really focusing on using those lower abs and that pelvis. You can also lower down a little bit too, and just make sure as you're doing that, you're only lowering to your body's comfort level and preference. So right up and then lower if it feels okay. The other thing that you can do, and it's not cheating, but it is a little bit easier, is bending those knees. Same idea, trying to come straight up, and then you would come straight down. And now here is where I see people go wrong. The most common thing I see go wrong with this one is people, instead of reaching straight up, they tend to bring their legs way too far backwards, right? So again, you're using a little momentum, the spine a little bit, and really not engaging in through those abs. The second thing I tend to see is that when people start to lower their legs, again, they go beyond what their body really wants to do and start to arch that spine, which again, more stress through that spine, less through those abdominal muscles. Lastly is straining the neck. Exercise 4 is the single leg deadlift and really gets those hamstrings and those glutes. So to do this one, and it is okay to hold on unless you really want to work on your balance, but to do this one, you're standing on one leg. This leg and back is just going along for the ride. So just a slight bend in that front knee, and you're going to take those hips and shift them back all while keeping this back leg straight as far as your body will allow you without bending that knee and with keeping that back straight, just like that drinking bird, if you're old enough to know what that is. And now here's where I see people go wrong. So the first thing that I see most commonly done incorrectly is people take that back leg and they try to use it instead of that front leg, so that they're kind of kicking that back leg up, which kind of negates a little bit at least that front leg and that front glute work. The second thing that I tend to see go wrong is that people round their spine as they're going into the exercise instead of keeping that flat back. So they're actually using more of their spine than their hip, which is what we're trying to focus on there. The third thing I see go wrong is that people tend to bend that front knee way too much as they're going into the exercise. And it's hard sometimes to keep all of this in mind, but again, it's trying to keep just a little bend in that front knee. And then the last thing I see is the leg that is lifted, people tend to turn that hip out. So again, not using that front leg like we are supposed to and putting too much emphasis on that back leg. Last one is the wall sit, the dreaded wall sit, which you may have done before, but it's really great for the thighs. So back flat against the wall or a door, feet are scooted out about hip width apart, and then you're coming on down. Back stays flat, you come down as far as you can to hold it here, and also, of course, making sure that you can get back up again. So here is where I see things go wrong with this one. First thing I see people do wrong is that they scoot their back away from the wall as they're sliding down. So this can definitely cause some back discomfort. The second thing that I typically see is that people aren't bringing their feet far enough in front of them, and then they tend to put a little bit too much stress on the knee, especially if you've got any knee discomfort. And the last thing I tend to see is that people want to favor their stronger leg. So they'll shift over to one side, even if it's just subtly, either going down or going up. One of the ways to actually correct this, if you're just not sure, is to have somebody watch you, or you can actually take 2 scales and place them under your feet, and you'll know, right? You want to be even on both scales so that you're even on your feet.